بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about imaging approach to childhood fracture, and I will discuss in this short talk the Salter-Harris classification with some examples. The Salter-Harris classification, we have 5 types of fracture. This is the normal, and this is the epiphysis, and this is in the green, it is epiphyseal plate, and this is the metaphysis. And in type 1, we have injury to the epiphyseal plate, and it can be manifested either separation or widening of the epiphyseal plate or nothing seen in the radiograph. In the type 2, we have injury to the epiphyseal plate and associated with the fracture of the metaphysis as in this example. In type 3, we have injury to the epiphyseal plate and epiphysis fracture. And that fracture, it is intra-articular. And in type 4, we have injury to the epiphyseal plate and fracture involving the metaphysis and fracture involving the epiphysis. And this is also intra-articular fracture here. And in type 5, we have a growth plate injury and a crushing. Here, this is the type 1 epiphyseal slip only, and here we have in type 2 fracture through the epiphyseal plate with a triangular fracture involving the metaphysis, and here a fracture through the epiphysis extended to the epiphyseal plate, and in type 4 a fracture of the epiphysis and metaphysis and epiphyseal plate. Type 1 Salter-Harris fracture, there is a separation of the and injury of the epiphyseal plate with separation as compared to in this example as compared to the medial aspect of the epiphyseal plate and some malalignment, and this accounts about 6 to 8% of injury and most common seen in children under 5 years of age. In type 2, we have injury to the epiphyseal plate associated with metaphyseal fracture as in this example, and this is the commonest type of Salter-Harris classification, and it is account about 70% of injuries and most seen in the distal radius and in children under 8 years of age. In type 3, we have intra-articular fracture through the epiphysis, which result in separation of the epiphyseal fragment. So we have injury to the epiphyseal plate and associated with epiphyseal fracture. And this account about 7% of injury and commonly seen in distal femoral and tibial epiphysis. Type 4, we have intra-articular fracture through the epiphysis, as we see here, extended to the epiphyseal plate, as we see here, and extended to the metaphysis. And this type is account about 12% of injury and most commonly seen in the lateral condyle of the humerus. Here another example of type 4 involving the distal tibia, involving the fracture. This is the above and below associated with injury to the epiphyseal plate. Metaphysis, fracture, epiphyseal plate and epiphysis. This is type 4. Type 5, there is compression of the physis, which has serious prognostic consequences, and this is serious epiphyseal physeal injury, and it is account about 0.5% of injury, and it is most commonly seen in the distal tibia and femur, but can be difficult to identify, particularly after fusion across the physis, and has begun in adolescence. As we see here, the compression of the epiphyseal plate and the epiphysis. Thank you for listening and hoping to see you soon in another talk.